Good day, everyone. This is our report in relation to chronic kidney disease stage 5 related to diabetic nephropathy. I am Trodamel J. Asibuke, and allow me to introduce to you our group members. For introduction, it will be discussed by Ms. Micaela C. Manto, patient history by Ms. Helen M. Nuki, diagnosis by Ms. Lilibet S. Camacho, anatomy and physiology by me, pathophysiology by Analisa Emperilla, risk factors by Ms. Josephine M. Capillan, pharmacology by Ms. Marilyn C. Pontanosa, treatment by Ms. Crisanta M. Surat, source by Ms. Elizabeth P. Olan, and prognosis by Ms. Jonalyn V. Takla.
Chronic kidney disease is a condition characterized by a gradual loss of kidney function over time, and is also known as chronic renal disease. It includes conditions that damage your kidneys and decrease their ability to keep you healthy. If kidney disease gets worse, waste build to high levels in your blood and make you feel sick. You may develop your complications like high blood pressure, anemia, weak bones, poor nutritional health, and nerve damage. Kidney disease has increase of having heart and blood vessels disease. These problems may happen slowly over a long period of time. Chronic kidney disease may be caused by diabetes, high blood pressure, and or other disorders. Early detection and treatment can open to keep chronic kidney disease from getting worse. Treatment for chronic kidney failure focuses on slowing the progression of the kidney damage, usually by controlling the underlying cause. Chronic kidney failure can progress to end-stage kidney disease, which is fatal without artificial filtering or a kidney transplant.
Patient history. The patient is 61-year-old, male, a Filipino farmer, and married with 3 daughters. And now we go to past medical history. At the age of 30, the patient experienced signs and symptoms of arthritis and has been prescribed with high dosage of medications. After showing signs of being in good condition, upon taking doctor's prescription, the patient relied on the medicines that he used to take whenever such the same problem exists, even without doctor's advice. The sad thing here was he medicated himself on the latter part that led the patient to suffer his kidneys in taking high dosage of medicines repeatedly. In addition to this, due to unhealthy lifestyle of the patient, such as smoking and drinking liquor, he developed diabetes mellitus type 2 or DM2. Over the years, he was experiencing abdominal pain for 1 week, and because of this, he decided to seek doctor's advice at CP Reyes Hospital located at Tanawan City, Batangas. Then he was admitted and confined for a week, and all the laboratory examination follows. In connection to this, it has been found out that he had a CKD or chronic kidney disease stage 5, secondary to diabetic nephropathy. Due to several complications like hypertension, diabetes, proteinuria, which means there is a high level of protein in the blood. As you can see in the attached patient's laboratory, through ultrasound, there has been a calcium salt deposition in the kidneys, resulting to decrease in glomerular filtration rate or GFR. That led to a lifetime treatment for dialysis. As it was being said, chronic kidney disease, the word chronic means cycled medication.
The 61 years old patient, male, has chronic kidney disease, stage 5 secondary to diabetic nephropathy. His doctor advised him to do those labs. See illustration above in his clinical history. He visits the nephrologist who trained in kidney disease, kidney dialysis, and transplant. The patient decided to undergo a dialysis treatment, hemodialysis, since June 2021 up to present. Base sa mga naging resulta ng laboratory ng patient, siya ay na-diagnose na mayroong chronic kidney disease stage 5, secondary to diabetic nephropathy.
Anatomy and physiology. The medulla of the kidney, also known as renal medulla, is the innermost part of the kidney and splints into different parts called pyramids. Renal medulla function in both kidneys is to filter liquid waste, retain fluid in the case the body is dehydrated, balance electrolytes, and eliminate extra acidity in the bloodstream. It processes the waste from the bloodstream through many levels of filtration, secretion, reabsorption, and excretion. Different kinds of waste such as urea, ammonia, and creatinine are directed through different channels to be sent to the bladder. This is the affected part of the kidney. This is renal medulla, which composed by pyramids. As for the patient, his renal medulla has affected because it cannot function and process normally. Normally, the function of medulla in our body is to filter all the waste, but because it cannot function like they were before, the kidney are severely damaged. All the high-risk medicine and also foods that is not good and too much that is absorbed by our body make it hard for our kidney to function normally. The patient also has diabetes. When we say diabetes, too much blood sugar has absorbed by the body, and because of this, the kidney are affected. The impression in the ultrasound of the patient shows that his kidney is normal with medullary nephrocalcinosis, bilateral, which means that there is a deposition of calcium salts in the medulla of the kidney. Medullary nephrocalcinosis is a disorder of the kidneys in which there is accumulation of excess calcium within the medulla of the kidney.
Treatment. When we heard about the story of the patient, we've been noticed the problem of the patient. So these are the treatment we've been doing. The patient has to maintain thrice a week bicarbonate hemodialysis. Maintain normal hemoglobin as per guideline for a CKD patient, and maintain a well-balanced diet according to his diet plan. This doctor recommended a limited of foods and fluids including grains, fruits, and vegetables, but limiting or avoiding whole grains and certain fruits and vegetables that are high in phosphorus and potassium. The patient recommended amounts of fluid is 32 ounces per day. The patient continually doing the treatment with the consent of his doctor.
Pathophysiology. Pathophysiology of chronic kidney disease secondary to diabetic nephropathy. Did you know that this is the cause of the case of the patient? The patient is a male, 61 years of age, and has an untreated diabetes. High sugar level in the blood, for all we know, damages the organs in the body. Like what Ma'am Troda said earlier, our kidneys are always at risk because of the high-risk medicines and other factors of it. This is the pathophysiology of chronic kidney disease secondary to diabetic nephropathy. Because of the hyperglycemia, increased sugar level in the blood, it develops hypertension because of high consumptions of fatty, salty food, smoking, and alcohol drinking. The patient was first diagnosed having a medullary nephrocalcinosis, deposition of calcium salts in his kidneys. Thus, because of hypertension and medullary nephrocalcinosis, he developed proteinuria, which is high level of creatinine and protein in the blood. As you can see in the attached hematology report, attached on our report, the diagnosis of proteinuria, the patient was advised to have a proper diet, stop smoking, and alcohol drinking. And because of the diet, the patient experienced weight loss, poor appetite, edema, shortness of breath, tiredness, and increased need to pee, difficulty sleeping, itchy skin, abdominal pain, and nausea. Because of the kidneys are damaged due to the prolonged medication which progressed to mesangial injury in the nephrons, leading to damaged nephrons. And because of these cases, the patient also developed possible heart and blood vessel disease. Over the years of taking up medicines, his glomerular filtration rate gradually and continuously decreasing, resulting to decreased urine output. Damaged kidneys progressed and lead to chronic kidney disease, which our patient is now experiencing. Due to the accumulated toxins and waste products in the blood that the kidneys fail to filter, the patient will most likely to develop possible heart and blood vessel disease. Hence, the doctor advised the patient or recommend to choose to undergo hemodialysis to prevent further damage in the body organs. He has also another option of kidney transplant, but it is costly and has so many risks due to his age and his diabetic condition. Patient thus must undergo hemodialysis twice a week for as long as he can to prevent damage in his heart and blood vessels.
Pharmacology. These are the prescribed medications of our patient. Sodium bicarbonate, used to relieve heartburn and acid indigestion. 650 mg oral tablet taken twice a day, morning and evening. Vildagliptin, used to treat type 2 diabetes mellitus. 50 mg oral tablet taken once a day, evening. Febuxostat, used to treat hyperuricemia, constantly high level of uric acid. 40 mg oral tablet taken once a day, evening. Lacidloc, used in the treatment of hypertension, 6 mg oral tablet. Tamsulosin, used to treat men with symptoms of an enlarged prostate. 400 micrograms oral tablet taken once a day, evening. 44FA, used for the treatment of iron deficiency anemia, anti-anemia, oral tablet taken 3 times a day, morning, afternoon, and evening. Sivilamer, used to control high blood levels of phosphorus in people with CKD who are on dialysis. 800 mg oral tablet taken twice a day with meal, morning and evening. Metoprolol, used to treat high blood pressure, also used to prevent angina, chest pain, and to improve survival after heart attack. 50 mg oral tablet taken half tablet twice a day, morning and evening. Clopidogrel, used to prevent heart attack and stroke. 75 mg oral tablet taken once a day, afternoon. Colchicine, used for treating inflammation and pain. 0.5 mg oral tablet taken once a day, morning. EPO-alpha or Epokin, used to treat severe anemia in chronic renal failure. 400 units subcutaneous injection taken twice a week. Prostacine, used to treat lower urinary tract symptoms associated with an enlarged prostate. Oral tablet taken once a day, evening.
These are the risk factors. First, diabetes. The second one, frequent use medication that could damage the kidney. Next, obesity or pananaba. Next, older age or pagtanda. The commonly one, tobacco use or paninigarilyo. High blood pressure or pagtaas ng dugo. Primary kidney disease like sample UTI. All of these are the risk factor of chronic kidney disease or CKD.
These are the source of our report. Hemodialysis and clinical of patient. Chemical abstract of patient. Chemical abstract discharge summary of patient. X-ray result of patient. Chemical laboratory report and blood chemistry of patient. Hematology of patient. Ultrasound report of patient.